Most people think a heart attack announces itself with crushing retrosternal chest pain or a dramatic collapse to the floor. We call that the Hollywood heart attack, and it's what almost everyone expects. But here is a terrifying clinical reality. Between 20% and 60% of all heart attacks are entirely silent or go completely unrecognized when they happen. I'm Dr. Voss, a cardiac surgeon. I've spent over 20 years holding hearts in my hands and treating the aftermath of cardiovascular disease. The most dangerous heart attacks I see in patients over 60 aren't the ones that knock you off your feet. They are the ones that whisper. They disguise themselves as a bad night of sleep, a pulled muscle, or an upset stomach. But make no mistake, the lack of dramatic symptoms does not mean a lack of damage. The heart muscle is still dying, forming non-contractile scar tissue that permanently weakens your heart. Today, we are going beyond the chest pain. I am going to reveal the subtle, deeply misunderstood warning signs of a silent heart attack and exactly what to do if you recognize them. Warning sign number 1, the toothache that isn't. If you wake up with a throbbing ache in your jaw, your first instinct is to call a dentist. But as a cardiac surgeon, my mind immediately goes to your heart. When your heart is starved for oxygen, it sends distress signals to the spinal cord. But because the nerves from your heart and the nerves from your jaw and arms share the same pathways in the spinal cord, your brain gets confused. It perceives the pain as coming from your jaw or neck, a phenomenon we call referred pain. How do you know the difference? Dental pain is usually sharp and localized. Cardiac jaw pain is typically described as a deep, pulsating, or throbbing ache, often on the lower left side, but it can even spread across your entire jaw. Sometimes, this ache is severe enough to actually wake you up from a dead sleep. If you have unexplained, throbbing jaw pain that gets worse when you walk around or exert yourself, do not ignore it. Warning sign number 2, the pulled muscle in your upper back. Many patients, particularly women, experience their heart attack as a dull ache or pressure between their shoulder blades or in their upper back. It is incredibly easy to write this off as a strained muscle from sleeping in a weird position or lifting something heavy. But there is a very simple test to tell the difference. Muscular back pain is positional. It changes or improves when you stretch, massage the area, or shift your posture. Cardiac back pain is non-positional. No matter how much you stretch, twist, or press on it, the deep ache will not go away. If your upper back aches and stretching does absolutely nothing to help, your heart might be crying out for oxygen. Warning sign number 3, incomprehensible daytime fatigue. We all get tired, but the fatigue associated with a silent heart attack is entirely different. Patients often describe it as an incomprehensible fatigue that feels completely unlike their normal tiredness. One patient perfectly described it as feeling like an empty balloon. This happens because a failing, oxygen-starved heart cannot pump blood efficiently to the rest of your body. When your brain and muscles are deprived of adequate blood flow, you experience a profound, sudden weakness. If you suddenly find yourself completely exhausted by a simple task you do every day, like making the bed or walking to the mailbox, that is not just getting older. That is a major red flag. You might be wondering, Dr. Voss, if a part of my heart is dying, how on earth could I not feel it? The biological mechanism of a silent heart attack is identical to a symptomatic one. A blocked artery stops blood flow to the myocardium, triggering cell death. But for many people, especially those with diabetes, a condition called autonomic neuropathy acts like a mute button. Chronically high blood sugar damages the nerves responsible for transmitting ischemic pain signals from the heart to the brain. In these patients, a major coronary occlusion can happen without a single ounce of chest pain. Instead, they might just experience sudden dizziness when standing, unusual sweating, or severe indigestion that they mistake for a bad meal. The silence of these heart attacks does not mean you are safe. In fact, surviving a silent heart attack puts you in terrible danger precisely because you didn't seek treatment. Because you didn't know you were in crisis. You didn't receive the clot-busting drugs or stents needed to save that heart tissue. The long-term risk of death following a silent heart attack is just as high as a recognized one. Having a silent heart attack increases your risk of chronic heart failure by 35% because your remaining healthy heart muscle has to work overtime to compensate for the dead scar tissue. Even more alarming, it increases your risk of a stroke by 47%, as blood clots can easily form on the scarred heart wall and travel to your brain. If you recognize these symptoms, or if you have risk factors like diabetes, high blood pressure, or a family history of heart disease, you need to take action. If you are experiencing these signs right now, do not wait. Call 911. If you suspect you may have had a silent heart attack in the past, ask your doctor for two things. First, an ECG or EKG. This frontline electrical test can spot pathological Q waves, which are telltale markers of past heart muscle damage. Second, a high-sensitivity troponin test. Troponin is a protein your heart only releases when it is damaged. Modern high-sensitivity tests can detect even microscopic amounts of heart damage in your blood, allowing us to spot an injury that might otherwise be missed. Advanced imaging, like an echocardiogram or an AI-powered cardiac MRI, can also visualize the exact location of the scar tissue. I want to be honest with you. The hearts I have had to repair didn't fail because the patients did anything malicious. They failed because these patients didn't know how to translate what their body was trying to tell them. They thought it was just a toothache, a pulled back muscle, or just feeling run down. You now have the translation. You know what the whispers mean. I genuinely want you to answer in the comments below. Have you or a loved one ever brushed off one of these subtle warning signs? You are not alone. If this video opened your eyes, please share it with a spouse, a sibling, or a friend over 60. You could be the reason they get to the hospital in time. Disclaimer: everything I've shared is general medical information based on current cardiovascular research. It is not a substitute for personal medical care. If you think you are having a medical emergency, call 911 immediately. Take care of your heart, and don't ignore the whispers.